Good evening everyone, I'm Dr. Tarun Singh, consultant physiotherapist at Ashwin Specialty Hospital, Somajiguda, Hyderabad. So today I'm going to talk about MET, that is muscle energy techniques. So what is muscle energy techniques? It is a form of soft tissue or joint mobilization techniques to treat the variety of musculoskeletal conditions. So here we are having one of our colleague who is having upper trapezitis pain. So I'm going to demonstrate few techniques of MET. So in the MET, what we'll do is we'll utilize the patient energy, that is his only muscular effect, to treat and produce the therapeutic effect. So in this patient, that is Suresh, is having upper trapezitis pain. So I'm using his own muscle energy to treat his pain. So with the help of MET approach, we can increase the joint range of motion and reduce pain and stiffness of the muscles. So here the Suresh is having over the pain over the upper trapezitis and reduction in the range of the motion, that is towards the side flexion of his neck and head. So what I'm going to demonstrate here is the MET technique for the upper trapezitis. So here I'm going to follow the 4 steps. I'm asking the Suresh to take his head passively, how much he's going to go. Then I'm going to palpate his muscle, that is the end level, and later on I'm going to give a resistance towards his movement. Okay, the first step. So I ask the Suresh to bend his neck over the side. So I can feel there is a muscle contraction or a local barrier which it cannot go further. Now what I'll ask the Suresh is to bring back both the shoulder and head towards it. So in this example, I'm going to treat the upper trapezitis. I'm asking the Suresh to do the movement over the left side. So I can feel here over the left on the trapezitis there is a barrier. So he can't go further. So what I'm asking is to just contract his muscles over the direction towards my hand. Hold it for 5 to 7 seconds and relax. The muscular effect should not be more than 20% and not overcome the therapist's resistance. Again, Suresh, please perform the same movement again. Relax. Again. Relax. So this is the classical example of MET. In these are the muscles that are called agonists, which the sile is affected. In some patients, they cannot do the movement. So we'll even ask the patients to do antagonist muscle, that is the opposite sides. So I demonstrate you how to do over the opposite side. Same. Stabilize the shoulder with the one hand and just over. Then I'll ask the Suresh to do the movement. Okay, relax. Once again. Relax. This is for the antagonist. So there are 4 types of MET, that is pulsed MET, that is pulsed muscle energy techniques, in which what we are going to give is, we are going to give the pulse, that is minute contractions over the antagonist muscle, not over the which side is affected, but opposite to the side of these. So I'm going to demonstrate these. I'll ask the Suresh, I'll stabilize with the one hand with shoulder and other hand over the neck. Then I'll ask Suresh just to contract and relax. Again, we are not going to hold this, but we are making him to do minute with number of repetitions. Relax. Mali. Relax. Mali. Relax. Benefits of these pulse muscle energy technique is relaxation of the agonist side and rapid contraction and strengthening over the antagonist side. So the next form of MET is rapid eccentric isotonic stretch. In this type of MET, what we are going to do is we are going to break the adhesions on the agonist side, that is the side which is affected. So what I am going to do is I'll ask the Suresh to perform the activity, that is muscle contractions passively. First we have to locate the barrier. Okay, then I'm going to stabilize Then I'll ask the Suresh to do the movement. Relax. Then I'm going to give a passive stretch. In this MAT, what we are going to do is we are going to break the adhesions and increase the tissue resistance and lengthening of the tissues over the agonist side. Now again, what we are going to do is we are going to see the range which is increased. Again, we are going to stabilize and we'll ask the patient to do the movement, again contraction and stretch. Relax. Now, the third form of MED is slow eccentric isotonic stretches, in which we are going to stretch the antagonist part of the muscle and relax over these muscles. That is the agonist muscle. So what am I going to do is I'm going to ask the Suresh do isotonic contraction and just I'm going to give the stretch over the side. Relax. After this, we are going to see the barrier, how much the range is increased during the first session, and again from here we are going to start our second talk. Relax. Start. So in this form of MET, what we are going to do is we are giving the reciprocal inhibition over the agonist and stretch over the antagonist muscle. So the last form of MET is isokinetic MET. In this form of MET, what we are going to do is we are demanding the efforts of the patients in all the direction. Likewise of the cervical isometrics, in which the patient performs over the anterior aspect, over the sideways, over the posterior, over the side. That is over all the direction. It helps in greater stability of all the joints of head and neck. So I'll ask the Suresh here to overcome the resistance of my hand over these movements. Suresh, just push towards my hand. Relax. Towards back. Relax. Towards side. Relax. Towards this side. Relax. So it helps in providing stability of the head and neck joints, that is over the spine. To increase the treatment efficacy, we can even combine these MET techniques with the respiratory synkinesis and visual synkinesis. In the respiratory synkinesis, we'll ask the patient to inhale during the contraction and exhale during the relaxation phase. So here on Suresh, I'm going to demonstrate the respiratory synkinesis. During contraction, I'll ask the Suresh to inhale, relax. During exhale, I'll ask the Suresh to exhale. So Suresh, inhale, relax, exhale. In visual synkinesis, I'll ask the Suresh to see towards the muscles while doing contraction and towards the muscle doing contraction and relax in opposite direction. Suresh, please see towards your muscle doing contraction. Relax. See towards your muscle while doing contraction. Relax. So this is about MET. I hope you understand the treatment concepts of MET and other anything